Hello and good afternoon. We are live at SSM Health Outpatient Center in St. Peters. We're here with Dr. Rebecca Melvin, and we're here to talk about wellness checks for children. And first, let's talk a little bit about what is a wellness check.
A wellness check is to check development, growth, and multiple different aspects of child development, whether it's their height, their weight, social interactions with other kids. Also, if they're behaving appropriately, because most parents will say, my children don't listen, but are they listening in school and not at home? Is it situational, things like that. But wellness checks is just to make sure they're hitting all their milestones, growing and developing as they should.
So a wellness check takes place yearly?
It does, well, in the first 2 years, it's actually a little bit different of a schedule. After 2 years of age, it does move a little bit spaced out more to 3 years, 4 years, 5 years, and usually annually. Some parents may or may not bring them in as frequently because schools don't require it, or, oh, they've had their shots, they don't necessarily need to come. But most kids from 2 under, they are coming every 2 to 3 months. Then it spaces out to 6 months. And some kids will come at 2.5. So I usually go through the schedule as they're here at their 2 week, then the 2 month, 4 month, 6 month, 9 month, 12, 15, 18, and 24 months. And then at that 2.5-year-old visit to make sure they're still on target with speech and growth and eating well, and because kids get picky and don't want to eat as well. Just the general things that we take for granted in life that may not be hitting those milestones.
So those are things that you're looking for when you visit. So yes. Size, height, weight. Why is it important for a physician to stay on top of something like that?
Well, with height, weight, and also with the younger kids under 2 is the head circumference. You have your head circumference if it grows too big or it's not growing enough. It's not just that they got to have a big head. There may be extra fluid all around the brain that can inhibit them from developing their normal neurological issues where they're starting to talk, gross motor where they're walking and running and throwing a ball, kicking a ball, riding a bike. Those are all factors in that. Height and weight. With some kids you can tell if there's maybe an issue of growth hormone problems, thyroid issues. Kids with hypothyroid may not be growing. They tend to be shorter initially and then they get chubby. Not all of them will get chubby. Some kids will be very thin and shorter, and it's not just that they're a small child. They may be, but they may not be. So you want to make sure that the growth velocity is on target versus just, oh, they're this tall, they're not tall. You want to make sure they're growing in the normal range.
Now we talked a little bit about, you said that one of the things you check at a wellness check is the social growth. Tell me how you would check something like that.
It's more of a history and talking with parents, also seeing their interaction with myself or other pediatricians. If they're seeing a child, does a child come in and wave hi or wave bye or blow kisses? Those are all normal social interactions. Some of the abnormal social interactions would be that they don't make eye contact. They're not necessarily getting along with other siblings or peers of their age. So if they're in daycare, they tend to play by themselves instead of playing with others or wanting to play pretend. So a lot of it's more of asking questions on what do they do at home. Some of it they may do in the office with us, like grab mom's phone and talk on the phone and pretend that they're texting or things like that.
So if I'm, I have 2 small children and I maybe don't have a pediatrician for them. What kinds of things would you tell me what's your skill set with children? Like, how do you interact with children and their parents? It's an important relationship.
Well, I talk to parents as if they were more of a friend type situation on how I would help them learn to talk to their children, guide their children, because children need guidance in order to grow and develop. They need that guidance. They need interaction. They learn by creative play, not necessarily by TV or using the use of media, tablets and things like that. That's not meant for the little kids. They should be more playing. Things that I do, I I will get down on the floor with the kids and play with them. If I have the blocks available, I will check their fine motor, stack blocks, and that checks that they can actually pick something up and stack it on something else, and that's the normal development. Other things I do is blow bubbles. That tends to calm them and make it more of a fun environment, and also gets them to be creative and how can you blow those bubbles away or pop the bubbles with your hands and things like that.
So these wellness checks are really a great way for you to form relationships with these families.
Absolutely.
Why is a relationship important with a family?
Well, most parents, they want to have a trust, and that relationship is more of a trust-building relationship. The kids, they see it as, I'm not afraid. I know that they come to see me, Dr. Melvin's not going to hurt me. I'm here to stay healthy. I've had kids come in and they come and say, hi, Dr. Melvin, and give me a big hug, and they know they're going to get shots, but they're not as afraid because they know it's meant to keep them healthy and not to harm them. We're here to make sure they're growing and developing normally. And that's actually one of the satisfying things for me is when a child comes in and blows that kiss and says, see you later, or bye, and gives you a hug before they leave. So.
Now, staying with these wellness checks as a child and staying consistent with them, will this help them later in life live a healthier life?
It does, because we also ask about what kind of foods do they eat. Are they getting their balanced diet? Fruits and vegetables, proteins and meats, because not every child eats meats, but they do need a source of protein for normal development. Are they getting enough calcium to build that bone strength to its maximum at a younger age instead of worrying about it when they're older, and as we age our bones get thinner. So talking about how we can keep our bodies healthy younger so we have an easier life later. Also, routine testing it changes as kids are growing older. We used to check cholesterol only in adults. Now we check it in children because the start of the problem starts 10 years before it has a problem with an adult. So if we target the children to say, let's make sure we're not eating fast foods, we're eating healthy fats and not sweetened beverages and things that can affect us long term, we can make those impacts on kids because they want to be healthy longer term instead of trying to make the change that we already have bad habits as adults.
So let's say you're at a healthy wellness check. What happens if you maybe come across something that concerns you? What happens then?
First, it's education. Talk to the parents. Why is something the way it is? Is it home life situations? Is it financial? If there's something that concerns me, I'll use the example of a baby's head is growing too fast. We want to intervene early before their development is hindered. So that if a baby is 6 weeks old and their head circumference is 3 times the size it should be, we're going to intervene and look to see why is that. Is it that there's extra fluid on the brain, or is there other signs of trauma or things that can be affecting that? Because if we don't make changes or intervene by whether it's seeing a specialist like a neurosurgeon or a neurologist, getting them to those specialists early can have better outcomes, and then their growth and development can get back to on target as they grow.
At what age do you think people should stop having these wellness checks? So is it 18, pediatrician?
Well, with a pediatrician, yes, that would be about 18. Some of us will see children as they're into their early adulthood for college age. But really, annual physicals never end. That should be something that you do see as routine care with your primary doctor. As they get into the adult, as I say, the adult land, as they hit adulthood, they want to see their family practice or internist to maintain that normal relationship to have preventative care.
Do those wellness checks change as kids get older?
I still recommend, and so does the American Academy of Pediatrics, is annual wellness exams to make sure things are still going along as planned and how they should be meeting their targets. With teenagers, we want to make sure that they're having a healthy environment in school. Bullying is a big problem. Suicidal risk is a problem. So those are things that we assess in those visits to make sure, do they have a good support network with their friends or even parents? Do they feel comfortable talking to the parents about teen issues that they're facing on a daily basis that maybe we didn't face 20 years ago when we were teenagers as adults and parents? So having them every year is still a good thing because things change, and we want to make sure we know that if there's something that's concerning to discuss or have intervention at that point.
Let's say I'm a parent and I have kids at home and I'm seeing something that just kind of scares me. School started, maybe my daughter's coming home and she's just like, kids are being mean to me, or you know, something along those lines. I'm having headaches, something like that. Is that something we should call you about immediately? Or?
I would kind of journal it first. If it's something that changed and they said the kids aren't being nice to me and then the headaches start, maybe try to see if there's a pattern first, because seeing them for the first time, we may not figure that pattern out right away. We could see them right away, but we may still need to do that journal initially to say, is there a pattern or is this something that's more concerning? If it's a change and more severe a headache that wakes them up in the middle of the night, those would be red flags that we need to see sooner. So it's just kind of, you can always call and ask, what do we need to watch for first, and then maybe help guide and then revisit it again.
But you guys are always available as a resource.
Absolutely.
For parents who are maybe having issues at home.
Absolutely. We're always available with our computer system. My chart is an easy access for parents to send a quick question. It may come up after hours and 8 o'clock, 9 o'clock at night, and we're like, I wonder if there's something going on. Sending a non-urgent message is a good thing. We can always get back and say what the next plan would be.
And by starting with that wellness check, you're formulating that relationship with the physician, leading to this hopefully quality of care throughout the year.
Absolutely.
Because wellness exams are just once a year, right?
Most wellness exams, once they're over age 2, are at once a year. But if there's any issues that arise, definitely we're available to be seen, to see the children.
What if a parent is at home saying, why do I have to go in once a year? My kid's healthy, they're never sick. Why do I have to take them in? That's like, you know.
Well, one of them is to make sure that they are socially, as we said before, socially interacting appropriately. Maybe there's something they're not telling mom or dad, but they feel more comfortable telling a pediatrician because they do have that bond. Adolescents are notorious for not telling their parents anything, and then they will tell the pediatrician and want help. So that's why it's good to have that relationship and also see once a year at least. And also letting the kids know if you have any concern, and even if you don't want to tell mom right away, come talk to us, mom or dad. Tell them that you need to come talk to us. We'll talk to them, help guide them making the right decisions, because as teenagers hit those years, they need to start becoming independent, but also knowing when to rely on their parents too.
And it's patient-doctor confidentiality, right? The kids can feel comfortable doing that.
It is patient-physician relationship and confidentiality. Not in all situations. If they're going to harm themselves or harm somebody else, that's when we break that confidentiality, because it's a threat of harm to either them or somebody else. So there are situations, and I personally am very forthcoming with that to teenagers, is these are the only situations I can break that confidentiality, and I'm not going to tell them things that you don't want me to tell them unless those two things can be of danger to them.
So really, the thing that I'm taking away from this is it's important to form a relationship with the physician.
Absolutely, it is, and that relationship is golden with kids. So
yeah. Is there anything else you want to add about wellness checks or?
One of the things that I even learned this morning, I was talking to my brother about the discussion we were going to have, and my brother, I have a twin brother who has 6 kids, and he mentioned that some insurances and such as his get a discount with getting their wellness checks. So it gives them that incentive to say, hey, I want to make sure my kids are healthy, but I get a little kickback with insurance premiums rising in this country at this time. Wellness exams, most insurance companies cover their wellness exam, but it's ultimately you need to check with them, because sometimes they are not covered because there are very few out there that are only accidental coverage only. So with the Affordable Care Act, we were supposed to have wellness for all children, but there are some of those insurance companies that just haven't abided by that at this time.
So that's something people should definitely check into.
Yes, parents should really look into their insurance. You may have a benefit that you don't even know you have, but also even if the insurance doesn't cover wellness, there's always we need to see them just to be sure that they are growing and healthy growing and living a healthy life.
Thank you so much for joining
No
us
problem.
today.